The primary benefit of Mohs surgery is it provides the best cure rate of any other treatment that is currently available. It allows for the precise removal of the skin cancer while maximizing the preservation of your normal skin. The procedure itself is named after its originator, Dr. Frederick Mohs, who recognized that cancers were not being removed at all, actually, even though they may have, at the time, thought that they were removed. So he developed this technique to map the cancer, to trace its roots and remove the microscopic extensions, literally every speck of the cancer. So this really makes it the ideal procedure for treating cancers in cosmetically sensitive areas such as the face, or functionally critical areas such as the nose, the eyelids, lips, ears, and fingers. So here's how it works. So when we talk about successfully removing a tumor, we're talking about having clear margins. That means not only removing the tumor, but also a small margin of the healthy skin surrounding the tumor as a sort of buffer zone against recurrence. With standard techniques, the surgeon removes your tumor along with a wide, arbitrary margin of healthy skin and sends it to an outside pathology lab for analysis. There, pathologists cut it like a loaf of bread and examine it to make sure the surgeon got the whole of your tumor. Of course, most tumors aren't spherical like this tumor. They grow haphazardly and unpredictably. So often what you see on the surface is just the tip of the iceberg, with these microscopic roots that branch out from the main tumor. So if your tumor has an odd shape and is ill-defined, and the lab discovers the surgeon's margins aren't clear, that there are still some cancer cells along the edges, you would have to come back for another operation. The whole area gets re-excised, tissue gets sent back to the pathologist, and that whole process repeats itself. So back and forth until the surgeon and the lab feel they've got all of it. Now, it's important to note that pathologists don't examine all of the tumor's margins, just a few sample sections. This means it's possible to leave cancer undetected if it's in the margins between the sampled areas. Obviously, both you and your surgeons want to avoid multiple return visits. Unfortunately, he can't see what's hiding below the surface of your skin, so his best and most efficient option is to cut wider margins. That is, cast a wider net in hopes of getting all of your tumor's parts no matter what its size or shape. This is an acceptable technique when you're dealing with cancers that might be more well-defined or perhaps not as aggressive, or in areas where there is excess tissue, such as the back, so that then you might not be as concerned with sparing tissue. Now, you might be wondering, in those situations when the pathologist notes that cancer is present at the margin, why then doesn't the surgeon just go and cut out in that one small area where the cancer has been left behind? Well, there is an inherent disconnect between the surgeon and the pathologist in these kind of situations. Typically, the surgeon has already closed the wound, and when the pathologist then gives the report back to the surgeon, they typically relay in sort of broad terms the cancer is present from 3 o'clock to 6 o'clock. The surgeon really has no choice but to go in and just cut the whole thing out again. And then, of course, there's the worst case scenario when cancer is just left behind undetected, and neither the pathologist knows it and certainly the surgeon doesn't know it. Mohs micrographic surgery is what we call a tissue-sparing technique. We are able to precisely remove your cancer, but conserve your normal skin. Now, we can do this because our doctors are fellowship trained in both skin cancer surgery and pathology. We examine under the microscope 100% of the true surgical margin at the time that the tissue is removed during your visit, and we're not going to let you leave until we've got all the cancer. We work in stages. First, removing the tumor we can see, plus a minimal amount of apparently healthy skin around it. We are trying to get the cancer out in the first stage because we're not here to waste your time, but we're also really trying to conserve your normal skin. Once the tissue has been removed, we take it to our in-office lab where it is oriented, mapped, and prepared for our microscopic evaluation. Then it's examined in incredibly thin slices. If we find any cancer at the margin, The mapping tells us exactly where in the incision we need to go to remove the remainder of the cancerous tissue. We repeat this process until the tumor is removed in its entirety, along with a clear safety margin of healthy, cancer-free skin. This is what distinguishes Mohs micrographic surgery from any other technique. Number one, since we're performing the function of both the surgeon and the pathologist, there's not that disconnect that can occur. And this is especially important when we've noted after the first stage that there is cancer remaining at the margin. So since we did the initial removal and the examination under the microscope, we know just where we have to go to get the remaining cancer. Number two, and perhaps the real power of the procedure, is it involves a 100% microscopic evaluation of the true surgical margin. This allows us to achieve the highest cure rates possible and preserve normal skin. Our surgeons at Henghold Skin Health and Surgery Group are fellowship-trained Mohs and reconstructive surgeons. Most of the cancers we are dealing with are in cosmetically and functionally sensitive areas. Once we know the cancer has been removed, we can reconstruct the area on the same day.